Hi, it's Ginger Bratzel from New Patient Attraction Automation, where we help you grow your practice, find more of your ideal patients, and put it all on systems so it works for you. I get a question, I got it just this past weekend from a client talking about sales scripts and closing and things like that, how to get people to do things, and how to get people who don't want to do things to do things. And there's an interesting concept about impacting people and persuading people. And there's certain things you can do. It's not that you're manipulating them, and that's what marketing and sales process gets in the way of. People think that's what you're trying to do, but it's not. You're trying to get people who are already interested to take an action, because in reality, people already have enough motivation. They know they need to do this. They know they need dental help. They know they wanted to do this. They actually got in their car and came to your office. You didn't grab them in a van and throw them in there. They came in. So they have a certain degree of motivation. It's trying to get them over that and getting them going. So even when I talk to doctors, when I talk about changing practices and everything like that, even them, there's that holdup, and it's on the how. How are we going to get through this? How am I going to deal with this? How is the finances going to work? How are you going to do this with my schedule? And they get so fixated on that, they can't get over it. And research shows us if we put them in the state of having it already done and get them in the emotional thing, because people buy on emotion, not on logic. They justify it later with logic. If we get them on the emotional standpoint, on the other edge, on the other end of it, how we got through it. So we talk about how would it feel to have this done? How would it feel to have that great smile? How would you feel knowing that you don't have to worry about a loose fitting denture? How would it feel not to have those missing teeth and know that you can eat what you want and you can smile with confidence? And putting them, focusing on those small steps and getting them over the hurdle and get them already in where they need to be mentally, then we can go back and solve the how for them, because we have solutions on the how. We know how to do the dentistry. We know how to work on the financing. We know how to work with insurance companies. But they're so fixated they can't hear it at that stage. So if you have a patient who's shut down, you got to get them over the how would it feel when we're talking about this in 6 months and this was all done. Because they already have enough motivation. You just have to get the small wheels going where they're going to swing the big doors and give them the best results. So that's what your job is, to get them through that process. And not only for patients it is, like I said, I talk to clients, how are you going to do this in your practice? You know you need to do something. Let's say there's something holding you up. How are you going to get on the other side? Well, let's put yourself already in what it's going to feel like to have it done. What would it mean to your practice? What would it mean to your family? And that will make a big difference. I would like to share something with you and give you some information. I don't give any other people unless you're on my list. You can't get on the website, you can't go to YouTube, you can't find anywhere else. And I only share it with these people on my list. If you go over to my website at gingerbratzel.com and opt in on that page, not only will I send you insight that I don't share anywhere else, it goes directly to your inbox, I also will give you a free CD about getting all the patients you need. So simply go in there, enter your name and email now, and I will get that out immediately to you, and I will give you a whole lot more information that you can use in your practice to grow. So until we talk again, take care.